All right, part 3 of chapter 9 here, beginning where we left off on part 2, looking at the measures of disease frequency inside a population. And there is the incident rate, which is the number of new cases in a defined population in a defined time, and then the duration in terms of how long the infection lasts. And on the right there you can see a figure that looks at the number of measles cases per thousands, and this was in the United States, and you can see a before and after effect of the vaccine. All right, prior to the vaccine there was a high incidence rate, and then given the vaccination, the number of cases, the incident rate, will then steadily declined here quickly after the vaccine was introduced, and then as long as the vaccine is maintained, then there's very few cases. And even in the situation last month with the measles outbreak in the state of Washington, that's actually very few cases relative to the number of people in the United States. All right, actually very small, but the number was actually quite significant based on the small area, the population, and what had been seen before. And one way to, look at disease transmission and then controlling disease is really just to be observant. And a person named Ignace Semmelweis showed that hand washing prevents disease. Now, to us, that seems quite obvious, but we know about microbes, we know a lot about how they are transmitted, and this was not always the case. And Dr. Semmelweis looked at two different types of maternity wards in the mid-1800s, and what he noticed was that in one type of maternity ward, this was where physicians would actually deliver the babies, and there was a high mortality rate in recent delivered moms. And then compare that to a maternity ward where it was staffed by midwives. And what you can see on the graph in the white area is that there's really a significant decrease compared to the physician wards in the mortality rate, the death rate of women. And so he wondered initially what was going on, and then he noticed that in the physician's ward, the physicians at that time actually did autopsies. If someone wanted to figure out why someone died, the physician, after the person died, would actually just start opening the person up to identify what caused the death. And Dr. Semmelweis noticed that the physicians were not washing their hands from going from the autopsy room to the delivery room. You can imagine that that would carry and transmit disease, microorganisms. And so he helped to implement hand washing practices, and then soon after that, the mortality rate between the two different wards was almost equal. All right, now within hospitals, you also have generally hospital epidemiology programs, usually an officer of some sort, someone who oversees what is considered to be the surveillance, prevention, and control of healthcare acquired infections, the HAI. HAIs are diseases that develop from a healthcare intervention of some sort. This could be long-term hospital care, care facilities, outpatient care facilities, the hospitals themselves. This is a major problem with healthcare-associated infections. This number increased by 40%, which is huge, in just a 20-year period. At that point, the CDC implemented what are called HAI reduction initiatives. Why was that? Well, the CDC estimated that that 1 in 25 hospitalizations developed an HAI. And often when someone develops an HAI, they become more sick than what they came into the hospital as. Approximately 75,000 people die from HAIs every year. This is significant. This is in the United States. That's crazy. And then HAIs cost approximately $35 billion per year. This is due to the added hospitalization time, the care, the people care, medications. Unfortunately, a lot of HAIs are caused by antibiotic-resistant organisms, and so it's very difficult to treat those, both in terms of trying to find medications. Often those medications are very expensive, and then also with time in the hospital. How are HAIs transmitted? Well, a lot of times through hospital personnel who inadvertently spread infectious agents. Hand washing between patients is extremely important, even after getting into a patient's room. So sometimes there will be hand sanitizer outside patient's room, but also there is hand sanitizer inside the patient's room. So the first thing that a healthcare provider does upon getting into a patient's room is to clean their hands through hand sanitizer. That way they're not bringing anything into the room on their hands. Also, medical devices are a prominent place for organisms that cause HAIs. And HAIs can be localized or systemic depending on how they were introduced into the body, and they can unfortunately affect any body system or tissue. Common HAIs, the biggest one, most prevalent one, is going to be Clostridium difficile. This is going to be a GI infection. Unfortunately, Clostridium difficile can be very difficult to treat, becoming antibiotic resistant. Numerous deaths occur because of Clostridium difficile. Then there are urinary tract infections associated with catheterization, surgical wound infections. There is a high prevalence of MRSA bacteremia, where MRSA methicillin-resistant Staph aureus gets into the bloodstream. Then intravascular device, central line-associated bloodstream infections, and then pneumonia linked with mechanical ventilators. All right, so here's another breakdown of the HAI pathogens, whether they're bacteria, viruses, or fungal organisms. You can see the examples here and then the different notes. What does Clostridium difficile actually do? It causes infectious colitis, inflammation of the colon. And it is any surface contaminated with fecal material can serve as a source for the infection. Clostridium difficile also produces endospores, so it can actually survive in long-term scenarios just on the surfaces. And I'll let you read the rest of the examples. So how do you prevent HAIs? Well, you have different surveillance and monitoring systems. Infection control personnel committees monitor the prevalence of HAIs, how they are spread. If there's a particular wing or department that has more HAIs than others, there's a lot of factors that go into preventing them, but the basic ones include hand washing, consistent use of personnel protective wear, gloves, masks, gowns. Then they can be disposed of once they've been contaminated versus not wearing those measures, having your clothes contaminated, and then moving from one patient to the next. Proper environmental sanitation, equipment sterilization. Notice the difference between those two words, environmental sanitation. Minimize the number of pathogens there, whereas with equipment, you want it to be sterile. You don't want a needle, you don't want surgical knives to have any bacteria, any fungal organisms on them. Then limiting patient transport. If they're in their room, they're somewhat isolated. Bring them out into the hallway, put them on elevators. Those type of activities will allow for transmission, whether it is a sick person being transmitted or a healthy person being transmitted and then coming down with being exposed to some sort of pathogen. Also, single patient equipment use. A lot of research, effort, money has been put into creating equipment that is designed for single use, basically disposable items. This this minimizes transmission from person to person. And then also isolation, very actual strict isolation procedures. All right, there's also superbugs. Those are the drug-resistant pathogens. Those often originate in healthcare settings because in a hospital setting, in a healthcare setting, there's a lot of antibiotic use. So it's natural that organisms in that environment see a lot of antibiotics and they are able to figure out ways to adapt and not be killed with them. All right, and hospitals have to be able to monitor antibiotic-resistant strains. If you are at a fairly large hospital, there will be microbiologists who routinely test for different pathogens, test for antibiotic susceptibility to minimize or to be aware of what organisms are actually inside their hospital. All right, there's different programs that look at the public aspect of monitoring the disease and prevalence, or the disease prevalence and incident rate of different diseases. In the United States, the CDC is the most recognized part of this process. They will dictate certain rules and guidelines down to state health departments and definitely surveillance networks to help prevent disease and be aware of disease outbreaks coming and being able then to go to that area and try to minimize continued spread. So there's what's called the National Notifiable Disease Surveillance System, NNDSS. This is a network of hospitals, labs, healthcare providers that will monitor and report certain diseases. And there are state laws that require reporting of certain diseases to the local health authority, and then those will then get reported back to the CDC. All right, and those are classified as reportable diseases. All right, HIV, chlamydia, the different STIs, MRSA, pertussis, a lot of the diseases that are eradicated or thought to be eradicated due to vaccine use. All right, the CDC wants to know how prevalent those are in the populations. All right, so the notifiable and reportable disease scenario, the idea is that being able to share data is going to make people safe. So there are different scenarios down here, labs, healthcare providers, hospitals that report based on state regulation, and those get reported back up to the CDC. So here you're looking at the national authority, and then also the CDC will report to the World Health Organization, or WHO, what you may typically hear referred to. All right, so we've talked about this, the emerging diseases, the re-emerging diseases. Those are definitely reportable diseases. Right? If it's a re-emerging, the CDC wants to know what's coming back into the population. Right, and here's just some examples of emerging and re-emerging diseases. Right? Different types of flu. The avian flu, which is classified as H7N9. Then there's the swine flu, H1N1, and a variety of other viruses.